Let me ask you a question. So you go to an independent doctor organization and you say to them, hey, I would like to direct contract with you, which obviously you did. How'd that go?
It was really interesting. We went on site. We have a medical director. She went to see for herself. We had members too that were already going there. So we talked to them about what their experience had been. And we looked at their credentials and talked to other doctors. So we had done all of that. The part that I will never forget was sitting in the room and talking to them about if we were going to do this kind of direct contract. And, you always talk about how you'll pay claims quickly and you'll get rid of some of the bureaucracy and that will all feel good to them. But we also talked about what percent of Medicare we would pay. And they sort of sheepishly said, well, currently we're renegotiating some of our network contracts because we're only getting between 100 and 130% of Medicare. So we would like to suggest 150%. And it took every ounce of discipline I had not to jump across the table and kiss them for that, because the alternative in that market in Monterey at the hospital is 800% of Medicare for chemo. So this is how out of whack this is, that a provider can tell me I want 50% more than Medicare, which is 50% more than what it should take to cover my costs. And I'm elated because that is a huge deal for us. But they were above board about it. We quickly reached an agreement and both sides benefit from it, right? And, our members end up with quality care. So it's a win-win.